going to start out with my skin assessment. So looking at the patient's skin, it's appropriate for race and ethnicity. The temperature is warm. He has an adequate amount of moisture. When checking the turgor, it returns to baseline within 1 to 2 seconds. I notice that there is no edema when I press down, and it's also free of any rashes, lesions, or lacerations. Moving on, I'm going to be assessing the patient's nails. So I notice that his nails are concave, they're slightly rounded. The nail bed is appropriate for his race and ethnicity. It's translucent. And then if I could please have you place your nails together. So when inspecting that, I could see a little diamond which states that there is no clubbing. So next I also need to check your, capillary refill. So I will just squeeze the patient's finger. And I notice that the capillary refill is less than 3 seconds. So next, I will assess the patient's head. It is normocephalic and it is also round. So there are, just during the inspection, there are no lacerations. I'm going to palpate the head. I know that there's no protrusions. Next, I move on to his scalp. I notice that his hair is thick. There is no thinning, and there are no lacerations on the scalp. And it is also free of scaling or vermin. So the next thing I'm going to do is inspect the patient's face. So I notice that his eyes, his eyelids, and his eyebrows are all symmetrical. They're also proportional to his face. I'm going to palpate his sinuses. So if I could just have you slightly look up. I'm going to palpate his maxillary sinuses. Is there any tenderness?
No.
Okay, perfect. So next I will move on to his eyes. So I notice that his sclera are white. Can I have you pull down your eyes and look up? So I notice that his conjunctiva are pink and moist. So next I'm going to assess for perla. So if I could just have you focus on an item behind me. So I notice that his pupils are reactive and they also react together. Perfect. If I could have you follow my finger, I'm going to test for 6 directions. Keep following my finger. Perfect. I'm also going to instruct the patient not to move their head. So the eyes moved in the 6 directions, perfectly normal. So next I'm going to move on to the ears. So upon assessment, they are, again, proportional. There's no edema or redness. I'm going to use my pen light again. Since he's an adult, I'm going to pull his peanut up. If it was a child, I would pull the ear down to see into the ear canal. Upon inspection, I see that his tympanic membrane is pearly white. It's intact, and all the structures are also intact. There's no excessive cecum or any exodus. After the ears, I'm going to move on to the nose. So I notice that his nose is symmetrical. It's also proportionate to his face. Can I have you look up, please? So again, using my pen light, I'm going to inspect the nares. And I notice that they are both equal and proportionate. I'm going to go back to the ear test because I forgot that I would also have to perform the whisper test. We've performed the whisper test, so if I could have you close your left ear. Please repeat this after me.
1, 2, 3.
I have you block the other ear.
ABC.
And I want to also make sure that the patient is not able to read my lips when I do that. Okay, so also for the nose, moving on, I get a small alcoholic pad. I don't tell the patient beforehand what I want to soak it in. So if I could have you cover up your left nostril. Please smell. And what do you smell?
Alcohol.
Okay, can I have you block the other nostril? What do you smell?
Alcohol.
Perfect. So moving on, I'm going to have him look up, please. Open your mouth. Say ah.
Ah.
So when the patient says ah, I want to make sure that his uvula is midline. I want to also make sure that his dentation is intact. The mucosa is pink and moist. I also want to make sure that there's no excessive film on the tongue, and that also his soft palate rises and falls when he says ah. Okay, moving on, we're going to do the neck. So I'm going to get behind you. So I notice that there is no edema, no swelling of the lymph nodes. I also want to check his trachea and make sure that it's mobile. So I will just slightly move that back and forth. After I do that, I want to check his lymph nodes. So I start with the preauricular.